Angelina Jolie's mother died of ovarian cancer when she was 56 years old. The Oscar-winning actress says she can now tell her children that that will not happen to her. Jolie revealed this morning she had a voluntary double mastectomy after discovering she has a gene that greatly increases her risk of getting breast cancer. Jolie says she decided to share her story in order to help other women be proactive about their health by exploring the many options available. And our guest is here tonight to explain some of those options.
Dr. Lee Wilke is a surgeon and the director of the UW Breast Cancer Center. Welcome to Live at 5.
Thank you. Thank you for having me here.
How common is this procedure that Angelina Jolie went through?
Well, certainly a mastectomy is a procedure that is normally done for women who have breast cancer. But when you prophylactically remove the breast and it's done to try and prevent breast cancer, it's not quite as frequent. It's not a procedure we perform every day, but it is something that we might perform every month. And it is not an infrequent procedure for patients who are at high risk like Angelina Jolie was.
Angelina did the genetic testing that revealed she had the gene, the BRCA2 gene.
Correct.
That increased her risk of getting breast cancer. Can you explain what that genetic testing is and what those genes are?
Certainly, we're all born with genetic mutations that make us look different and feel different, but there are some genetic mutations that give you a predilection for certain diseases. And the two genes that we know about most for breast cancer are called the BRCA1 and 2 genes. These are blood tests that can be performed on a person's DNA to figure out if there's a specific change in the DNA that puts you at risk for the development of breast cancer. The people who have these genes don't necessarily automatically get breast cancer. They have about an 80% chance of getting breast cancer. It can be as low as 60% in some mutations and as high as 80%, but it's not 100%.
So should all women, and men get breast cancer too, should everyone get this test to see if you have this?
That's an excellent question. The answer is no. There are specific guidelines for doing this test. The NCCN, the National Comprehensive Cancer Network, sets guidelines for us as to who should be tested. If there's a family member with male breast cancer, that's actually a very important finding in a family that they may have a gene, one of these genes, BRCA1 or 2. There are some other guidelines, such as a woman having ovarian cancer. Just one family member with ovarian cancer increases the risk of that family carrying this gene. If two women on a side of the family, either maternal or the father's side, paternal side, have breast cancer, then that's an indication that we maybe should be considering testing. But not everyone gets the testing. There are certain guidelines that we follow and go over with the patients to discuss whether we think they're at risk for carrying the gene.
Is the testing something insurance normally covers?
Most of the time, yes. Medicare covers it. It's if you meet the certain guidelines. Not every woman should get this test. There are certain families that we look at that are at increased risk, and we screen and talk with them. It's very important to meet with a genetic counselor. This is not something that you do lightly, because it is a long-term effect on both you and your family.
It was an important decision, a brave decision by Angelina Jolie that she made on this. Doctor, thanks for being with us today. Very
Thank you for having me. I
Dr. Wilke.
appreciate it.
Nice to see you.